To understand how topoisomerase inhibitors work as an anti-cancer drug, we need to first understand what they are inhibiting. The target, topoisomerase, is an enzyme that plays an important role in DNA replication by generating transient breaks in the double helix to prevent entanglement. This act releases the pressure that would otherwise occur from DNA supercoiling. If left unresolved, the damage on DNA would accumulate, potentially leading to cell death. Anti-cancer drugs then exploit this function of topoisomerases and inhibit their ability to rejoin the break in the DNA backbone. When introduced in the presence of cancer cells, the intended outcome is that inhibition of topoisomerase will lead to death of such persisting cells, thereby relieving the spread and severity of the cancer. Now that we understand how topoisomerase works, we can look into the methods by which TI drugs act. Although the biological mechanism is complex, there are two main methods by which these drugs manipulate the enzyme to obtain therapeutic effects, and they can be classified as catalytic inhibitors and poison inhibitors. Poison inhibitors have seen success in clinical applications. This method converts a normal topoisomerase into a cellular poison by inhibiting the religation step and generating an abnormal topoisomerase DNA complex. This stimulates strand breakage and damage that would ultimately contribute to the suppression of tumor growth. On the other hand, catalytic inhibitors aim to suppress the enzymatic activity by interfering with the binding between DNA and topoisomerase, even before scission, which causes impairments in the replication and subsequent processes. This type, though, has not seen much success due to high levels of enzyme in cancer cells. Some have proposed that the ability and effectiveness of catalytic inhibitors would diminish greatly against such a large quantity. In contrast, these high enzyme levels could actually heighten the potency of poison inhibitors since the damage could expand quickly. Overall, the sensitivity towards the drug seems to be highly dependent on the amount of enzyme that is present.
Now that we know how topoisomerase and its inhibitors work, let's cover some of the history and the discovery of the 4 FDA-approved topoisomerase inhibitors in action. Tamtotecan is currently approved to be used for cancers such as ovarian cancer in addition to small cell lung cancer and cervical cancer. The discovery of topotecan began with Dr. Monroe E. finding the anti-cancer properties of Camptothecea acuminata. They worked together to isolate camptothecin from the tree's bark. From there, Dr. Warren Ross was able to develop topotecan as an analog of camptothecin in the 1980s. From there, Dr. Warren Ross was able to develop camptotecan as a camptothecin analog in the 1980s. Following the development of topotecan came with the phase 1 of clinical trials and then the second phase in 1990s. The success of the clinical trials led to the FDA approval in 1990 for both ovarian and small cell lung cancer. Irinotecan is used for metastatic pancreatic cancer. Like topotecan, irinotecan is an analog of camptothecin. This derivative was first made in 1983 in Japan as a prodrug and is metabolized by the liver. After clinical testing, irinotecan was approved for treatment in Japan in 1994. The US FDA approved this drug in 1996 after their own trials for metastatic colorectal cancer. There has been no new FDA-approved topoisomerase 1 inhibitors since 2007 according to a review article published in November 2023. Etoposide is derived from the plant Podophyllum patalium and was isolated in the late 1950s by Hartmann Saltalian. Etoposide was modified to 10-niposide in 1966 and was sent to clinical trials in 1971. Their success led to the FDA approval of etoposide in 1983 and 10-niposide in 1992.
Now let's dive deeper into understanding the usage of topoisomerase inhibitors. So topoisomerase 1 inhibitor drugs mainly originated from a plant called camptothecin, and there's 2 types of FDA-approved drugs. So the first one is called topotecan with a molecular formula of C23H23N3O5 and has a molecular weight of 421.4 grams per molar. It's also administered through intravenous infusion with a half-life of 2 to 3 hours. Intravenous infusion just delivers the medicine directly to the bloodstream. And the second drug is called irinotecan, and it has a molecular formula of C33H38N4O6 with a molecular weight of 586.7 grams per molar. It's also administered intravenously with a half-life of 12 hours. And both are synthetic derivatives of the camptothecin and function by preventing the regulation of DNA strand by binding to the topoisomerase 1 DNA complex, causing the double-strand DNA to break, leading to apoptosis, killing the cancer cells. So now we're going to focus on the FDA-approved topoisomerase 2 drugs. So the first drug is called etoposide. It's a cytotoxic drug. It has a molecular formula of C29H32O13 with a molecular weight of 588.6 grams per molar. And it's also administered through intravenous infusion. It has a half-life of 4 to 11 hours. And the second drug is called tenofovir. It's also a cytotoxic drug that's used for patients with acute lymphocytic leukemia. It has a molecular formula of C32H32O13S and a molecular weight of 656.7 grams per molar. It has a half-life of 5 hours, and it's also administered through intravenous infusion. So both drugs function by forming a complex with the topoisomerase 2 in DNA, which accumulates breaks in DNA and prevents the cell from entering the G2 and S phase of the cell cycle, causing apoptosis, killing the cancer cells. But there's always a dark side to drugs, as there are many side effects that may accompany these drugs.
Although they are FDA approved, that doesn't mean they are safe to ingest for just anyone. They are promising drugs, but their extreme involvement may also lead to them affecting normal blood cells in the body as well. This can lead to serious or mild symptoms. Side effects are common among these anti-cancer therapy drugs, and they often include nausea and vomiting, hair loss or alopecia, as most chemotherapy drugs can affect hair follicles. Bone marrow suppression is another cautionary side effect. Topoisomerase inhibitors can suppress the bone marrow's ability to produce normal, healthy blood cells. Mild symptoms such as fatigue and weakness may also be present. Topoisomerase inhibitors are also able to disrupt normal bowel functions, which unfortunately leads some individuals to obtain diarrhea or constipation. Some topoisomerase inhibitors may also cause damage to the heart, leading to more severe symptoms such as shortness of breath, chest pain, or irregular heartbeats that are affecting the cardiotoxicity. Neurotoxicity is also another severe but rare symptom. Certain topoisomerase inhibitors may cause damage to nerves, leading to symptoms affecting numbness, tingling, or weakness in the hands and feet. If you don't mind the possibility of experiencing any of these side effects I just listed, then you should be good to go. But on a serious note, it is important to understand that not everyone experiences all of these side effects, and the severity of them may vary from person to person. This makes it vital to consult your doctor before administering drugs occupying topoisomerase inhibitors. Such medications may also decrease fertility for both women and men, and it is strongly advised that women that are pregnant or actively breastfeeding to stay away from these drugs.
And that was our crash course on topoisomerase inhibitors. Hope it was helpful. Tune in next time for more.